Dr. Cepeda, we are living in a world in which we know that we have a obesity epidemic. No, the obesity prevalence in the United States, in Mexico, in several countries is very high. And unfortunately, the Rio Grande Valley has been leading the prevalence basically in the whole country in the last decade. How can you describe to us the burden of diabetes among the Rio Grande Valley community?
So yes, diabetes is a significant health concern here in the Rio Grande Valley. We know that the prevalence here of diabetes is approximately 26%, which is way higher above the national average is estimated about 7%. Most of this prevalence is due to multiple factors, as you were mentioning. One of them is the high rate of obesity here that we have in the valley. We have the limited access to healthcare as well. Poverty is another one. And not to mention, most of the communities here, it's from the Hispanic Latino ethnic group. We are in a higher risk of developing diabetes than any other ethnic groups that it's worldwide. All the complications that come with diabetes in terms of microvascular complications, especially cardiovascular disease, and specific atherosclerotic disease, which we know is 3 times higher than any other cardiovascular disease in patients with type 2 diabetes, on top of the microvascular complications, which includes all the eye complication, kidney dysfunction, and nerve conduction problems. So we also have some barriers. We have some barriers in the healthcare system because also we have limited resources to help all these patients with diabetes because of the high prevalence of diabetes in the community. So these patients, they sometimes have limited access to diabetes educators, nutritionists, limited access actually to providers or specialists as myself, endocrinologists, due to lack of insurance or other cultural barriers. So I think that this, what we're doing in health public initiatives that we're doing right now, all these healthcare partnership in order to raise awareness, facilitate the access of patients to the system, educate them on healthy lifestyles and support them on their diabetes management. I think it's a great deal to every single individual living with diabetes.
Can you please describe how a physician, how an endocrinologist diagnose the patient with diabetes?
We do have 4 criteria, and patient can meet one of the 4 to be diagnosed as diabetes. And more specific, we're talking about type 2 diabetes, but it works for any type of diabetes type 1 and type 2, which are the most common and the ones that everybody knows. But we have the hemoglobin A1C, which is the 3-month average of the blood glucose. Hemoglobin A1C over 6.5 is a diagnosis of diabetes. We have fasting blood glucose 2 readings over 126. It's another criteria for diagnosing diabetes. We have the 2 hours glucose tolerance test, where patients drink the 75 grams of feral glucose 2 hours later to fail the test if the blood sugar is over 200. And finally, we have a random blood glucose of over 200, as long as the patient also has some symptoms of diabetes, such as frequent urination, thirstiness, weight loss, increased appetite. So those were the 4 criteria that we basically use to diagnose type 2 diabetes.